early signs that means you should get a sleep study done?
Okay, so the good question here is what are the early signs? So I can actually take you back to the earliest of the signs. And when we talk about that, we're talking about pediatric patients, your children. And often these children have adenoids and tonsils, which we dismiss as okay, as they grow older, they're going to regress. But what really happens is that due to various allergies, when these tonsils and adenoids grow in size, the child starts breathing through their mouth. And when the child starts breathing through their mouth, it completely affects the growth and development of the jaws. And because it affects the growth and development of the jaws, their airway through which they breathe becomes narrow. Now, these children grow up with a narrow airway. Eventually, they have to keep their head forward, maybe just like me, and as they keep their head forward they can breathe slightly better, but at night they can't stick out their neck forward to breathe better. So at night their airway collapses, their tongue starts falling back on their airway, and they can't breathe well. So earliest signs are actually mouth breathing. So if we can prevent mouth breathing in children, that would be really amazing. Another few signs of sleep apnea is that the patient wakes up with very tired feeling, nocturnal, constant nocturnal waking up for urination, frequent urinations at night. That's also one of the very common signs of sleep apnea. Weight gain, obesity, irritability, hormonal changes in women. There's so many different signs that a patient may experience from sleep apnea.
How is sleep apnea different from general insomnia or poor sleep hygiene?
Well, so sleep apnea is considerably different from general insomnia. Insomnia is a proper sleep disorder. Obstructive sleep apnea, on the other hand, is something that you can easily prevent, something that you can easily treat. So, a lot of specialists like pulmonologists, ENT surgeon, dentist can definitely treat obstructive sleep apnea. But if you've got insomnia, then probably you should see a physician or a sleep specialist. When you talk about poor sleep hygiene, of course, it goes without saying that we have to maintain a good sleep hygiene. We have to maintain a good sleep cycle. We should stay away from electronic gadgets maybe 2 hours before we sleep, and even maybe a couple of hours after we wake up, because that light which is emitted from these gadgets often messes with our hormones, which are actually important for maintaining good sleep cycle. So we definitely require a good and robust sleep hygiene in order to have a good sleep. Sleep is very, very important reset mechanism for your body. It's like if you work during the day and you need rest in the night. So if you work all day and if you don't sleep well at night, it gets carried forward to the next day. You do this more often, you do this for a week, you will notice that your entire productivity goes down. You cannot work to you best of your capacities, and it affects every individual on a personal and professional front as well.
What happens to your brain and body when breathing repeatedly stop during sleep?
So what happens to your brain is that, imagine that you're not getting enough oxygen. So your brain and your body kind of goes in a hyperdrive. It creates a fight or flight system. Your body goes in fight or flight. There's a certain part of your body, some nervous system in your body, sympathetic nervous system actually, which gets hyperactivated. It starts secreting a lot of hormones which makes your heart beat faster, which makes your body kind of goes through a partial arousal. So at night you basically, instead of sleeping, you partially wake up without even realizing it. In order to go in deep sleep, your body needs to be well rested. But if you are deprived of oxygen even for few seconds, your body partially goes into that arousal, which you don't probably realize, and that causes very poor quality of sleep, and all the internal body organs which are supposed to be relaxed and well rested, they are kind of semi working, they are semi working condition. So that's why these individuals, when they wake up feeling tired. Many of the times when the heart has to run faster, it may lead to certain cardiac events. If you know that majority of cardiac events, majority of heart related problems happen around 2 a.m. to 8 a.m. in the morning, and that is a time when you're deep asleep. So the problems in your sleep often percolate to your other body organs, essentially heart and brain. Chances of people having cardiac arrest while they are asleep are significantly higher because we believe that these incidences are quite significantly underreported. So it's quite risky.
Is your loud snoring actually a sign of something more serious, like obstructive sleep apnea?
Yes, most certainly. Some of the snoring can always be habitual, which is sometimes, but see, we have to understand what is snoring. So when a large amount of air tries to make its way through a narrow channel, the soft tissues in that narrow channel, they flutter and they create a vibration which creates the sound, and that sound is basically what we hear as snoring. So snoring is a sign of some obstruction either in the nose or most commonly in the throat. So whenever these obstructions become frequent, it start messing with your body's sleep cycle, and that is when it starts affecting your most of the body organs. And now this patient starts getting converted into obstructive sleep apnea, where there is more or less many times in the night cessation of complete breathing for more than 10 seconds, which is quite scary. It's like your body is gasping for breath, and that snoring is that desperate attempt by your body to hold on to any air that it has, or even to breathe more as much air as it can. So snoring, loud snoring, can be a potentially dangerous problem, and yes, it is very much indicative of obstructive sleep apnea.
So are CPAP machines are the only solutions, or are there other treatment options?
Well, there are various treatment modalities. When we talk about obstructive sleep apnea, it depends where the obstruction is. So, for example, if there is a deviated nasal septum in the nose, or if your nose is blocked, then of course visiting an ENT specialist and considering a turbinate reduction, either non-surgically or surgically, or correction of deviated nasal septum is very much warranted. If an obstruction is at the upper part of the throat, then also some ENT surgeons can help in this regard. If the obstruction is in throat, then there are specialist dentists who can make you an appliance on the upper and lower teeth, which will keep your lower jaw slightly forward, and it won't allow your tongue to collapse on your airway. So thereby your pharyngeal airway, your throat airway remains patent throughout the night. So another treatment modality, as I said, is a mandibular or the lower jaw appliance that one can wear at night. Apart from CPAP, which is continuous positive airway pressure, there are other masks like BiPAP, which are a little more advanced as compared to CPAP. There are various treatment modalities that one can consider, but I think paramount is that lifestyle modification, good sleep cycle maintenance, weight loss, sleep hygiene is also very important. Other allied therapies like yoga, meditation, these are also known to help. Good nutrition is also associated with good sleep. So definitely following all these techniques can be helpful for patients who are suffering from sleep apnea. As on today, the continuous positive airway pressure CPAP masks are considered gold standard, but things are changing and there are more and more treatment options as we are making strides to treat sleep apnea more effectively. So thank you so much. Get treated for your sleep apnea and wake up to a better tomorrow.